First muscle is therefore the frontalis, sometimes called the occipitofrontalis because it often has a connection that runs all the way from the occipital bone all the way through to the brow ridge. This muscle is involved in elevating the eyebrows, and there's often a component of pulling the forehead down towards it as well. We treat it with botulinum toxin to get rid of horizontal forehead lines and also to lift the eyebrows in certain instances. The next muscle we'll go to is the Proceris muscle. This is part of the corrugator complex or the glabella complex, and this muscle pulls down. So it pulls the forehead downwards and creates a horizontal line on your nose. That's the most common reason you might treat it in isolation, is because it helps get rid of a line across your nose and is sometimes used as part of a non-surgical rhinoplasty. The next muscle is your corrugator supercelli. This muscle is the one predominantly responsible for the Levenses lines. This muscle starts on the bone just above your nose and runs to the dermis of your skin and pulls the skin inwards, causing that little crease. And this is the main muscle used to frown. So we inject this muscle because it's the main muscle that causes the angry expression or Levenses on your forehead. So you look more relaxed and happier and less wrinkly if you stop that muscle from moving quite as much. The next little muscle is the depressor supercelli, which crosses the corrugator muscle and is often considered simply a little branch of orbicularis oculi, but it does contribute to frowning, and we usually treat it alongside the glabella complex without even having to think about it because it is so meshed in with the corrugator supercelli. So we inject it really as part of the frown line treatment and a way maybe of causing a small lift to the medial brow. The next muscle is the orbicularis oculi muscle, the most superficial muscle in this area. It lies on top of the others and is most involved with causing lateral canthal lines, but of course it's also involved with narrowing of the eyes. So if you close your eyes tight, it's orbicularis oculi that's doing that. It pulls the eyebrows down, it pulls the cheeks up, and it creates wrinkles around your eyes, which means when you relax this muscle with botulinum toxin, you get the opposite of those effects. You may get a little lift to your eyebrow, you may reduce the lateral canthal lines, and it can be a side effect that your cheek is less elevated during smiling, which is often not desired, but worth knowing about because that's how that muscle works.